Ladies and gentlemen, welcome to the Art of the Enrollment. Today's webinar will unveil the secrets of the industry's top performers in the field of Medicare Advantage. What you will see and hear today is the actual script and pertinent information that was compiled by some of the nation's most successful agents in the field of Medicare Advantage. This one-hour webinar will compile years of combined experience into a duplicatable format that will produce positive results when successfully applied. Today's speaker is a proven agent that has consistently ranked as a top performer throughout the country in the field of Medicare Advantage. The next voice you will hear will be none other than our very own Mr. Stuart Harris.
Thank you for choosing the Art of the Enrollment. This training program was created for today's Medicare Advantage telephonic and field agent professional. Congratulations, because this is your first step in learning how to effectively deliver a uniform, comprehensive, compliant sales presentation by mastering what we call the art of persuasive conversation. Now, in order to successfully sell a product, one must understand the product. Medicare began in July of 1966 with the primary purpose of providing affordable access to health care to our senior population. It began with a traditional fee-for-service delivery model. Once the beneficiary got sick, Medicare would cover 80% of the doctor visit and cover a portion of the hospital cost associated with inpatient care. However, this healthcare delivery method, fee-for-service, proved to be unsustainable. Now, under the fee-for-service delivery model, the health outcome of the beneficiary did not meet with the results originally hoped for. You couple that reality with the cost impact to the budget, and that created a problem that demanded a unilateral solution. So in 1997, the Balance the Budget Act birthed the alternative. It was called Medicare Plus Choice. And in 2003, the Medicare Modernization Act gave way to what we now call Medicare Advantage Part C. So now that you understand why the product exists, we can begin to discuss how it should be sold. Regardless of what product or services you offer, certain things remain the same. They're called sales fundamentals. In Medicare Advantage, the foundation of a successful presentation begins with a successful needs analysis. This will allow you to assess the most important thing, which is, can you help the beneficiary? And how can I help the beneficiary? It's the old adage, seek to understand, then be understood. Now, on the next slide, we will cover some of the key questions to ask. Is there a monthly premium associated with your current plan? If so, how much is that premium and is it affordable? Do you take any prescriptions at this time? If so, what are your copays? Now, ask specifically whether the copays are $2.55 or $6.35. We ask this question to determine whether the beneficiary has a low-income subsidy, also known as extra help, which may create a special enrollment period. Now, only if you're in a market that offers a special needs plan, ask whether they take specific prescriptions that would create an SEP in that market, i.e., diabetic pills or insulin. Another question to ask is, do you have a primary care physician? And if so, how long have you been seeing your primary care physician? Additional questions to ask would be, is there a copay associated with your office visit? If so, what is it? How often do you see your primary care physician? And is that doctor conveniently located to you? Do you see any specialist? If so, what type and how often? What are the copays associated with the office visit? Are you receiving any home health care? If so, how often? Are you receiving any additional benefits, i.e., dental, vision, etc.? Hint: focus on the additional benefits your plan offers and be sure to use this as a segue into better coordinated care equates to better health. Now, we have already discussed speaking to the direct needs of the beneficiary. What this does is articulate that you know and can identify with the beneficiary's problems. Now, this is step one. Step two is articulating what the comprehensive solution is. Covering the four parts of Medicare allow us to draw contrasts. Parts A and B presents the problem, while Medicare Part C provides the solution. Assuming the sale begins from the time the beneficiary answers the phone. The following two examples will illustrate the typical greeting of a presentation, followed by a greeting in which the agent is assuming the sale. Hello, my name is Bob Brown. I'm calling from the Senior Processing Center. Is Mr. Jones there? This is example number one. With example number two, Bob Brown, the agent, does not ask, he assumes the sale. Good afternoon, Mr. Jones? If you notice, Bob Brown exclaims the introduction. He doesn't ask it. Now, with the art of the enrollment, you must always assume you are speaking to the person who answers the phone, unless, of course, it is clear you are not, either because you are speaking to a child or the opposite gender. To be a great salesperson, you must use human emotion and human instinct to your advantage. After the caller answers the phone, you automatically proceed as though he were the intended prospect. When Mr. Jones has identified himself, you will proceed with the standard pleasantry. Now, if Mr. Jones says, "I'm not feeling too well today," your response should be, "Well, you know, Mr. Jones, I'm sorry to hear that. Hopefully, I will be the bearer of good news today." If you notice, I did not allow Mr. Jones' mood to affect my presentation because I'm starting the presentation with the mindset of assuming the sale, getting to the sale, and always controlling the conversation. The reason I'm calling today, Mr. Jones, is because you requested information about getting more out of your Medicare benefits, where you listed your address as. Is that correct? Your first objective is to get Mr. Jones to say yes. Again, my name is Bob Brown, and I have been assigned to assist you today. Our calls are monitored for quality control purposes. Now, this next slide discuss utilizing unconscious awareness. To understand this is to understand two things. First, you must become an effective educator when communicating to the beneficiary. Know that most beneficiaries are searching for a credible, trustworthy resource. This is what they're listening for during the course of your presentation. 2. Your presentation must demonstrate a plan to achieve and maintain a better health outcome. This will distinguish you from your contemporaries. Remember, coordination of care equals a better health outcome. Now, in presentation number 1, the beneficiary is aging into Medicare with no secondary coverage. Let's begin. Mr. Jones, do you currently have Medicare Parts A and B, or will your Medicare go into effect the month you turn 65? Mr. Jones, are you retired? Did you retire with employment coverage? Mr. Jones, what would you have to help you cover the 20% and other copays Medicare does not cover? I see. Well, have you received your Medicare card, Mr. Jones? Now, the reason I asked Mr. Jones whether he received his Medicare card is because oftentimes we'll begin a presentation assuming the beneficiary has Medicare, only to find out 25 minutes, 30 minutes into the presentation, the beneficiary does not qualify for Medicare. So you always want to confirm that they do have Medicare, and one of the best ways to do that is by asking the question whether they have received their card or not. Good. Mr. Jones, do you take any prescriptions at this time? Okay. Mr. Jones, if you look at your Medicare card, you will notice that there are two parts listed, Parts A and B. Now, your Part A covers some of your hospital bills. So if something were to happen to you, causing you to be admitted as an inpatient in the hospital, you'll receive coverage under your Part A, but only after you have paid the initial deductible of $1,216, which covers a benefit period of 1 through 60 days. Then you'll be responsible for 20% of all the medical care you receive while you're in the hospital. This is the reason why your hospital bills can quickly escalate to thousands, and in some cases, tens of thousands of dollars. Now, I haven't met a person yet, Mr. Jones, that has that type of money just sitting around in their bank account waiting on a medical emergency. Now, this is what we call a Me Too moment. There will be several Me Too statements delivered throughout the course of the presentation, and this is one of them. So ultimately, what we're trying to do here is get Mr. Jones to say, you know what, that is my situation. We want Mr. Jones to identify with the individual being described in the presentation. Now, your Part B allows you to see your doctors and covers up to 80% of your medical bills resulting from those visits. Mr. Jones, under Original Medicare, you will be responsible for 20%. Now, even though there are 2 parts listed on your Medicare card, there are actually 4 parts to your Medicare. The third part is Part D, which will provide you with the prescription drug coverage. Now, Part D began in 2006. Now, the fourth and final part is what I want to focus on for just a moment, because if you qualify, it's the part of Medicare that will help close the coverage gap left by Parts A and B. It's called Medicare Part C. Now, I use the language if you qualify because what we want to create in the mind of the beneficiary is value. We almost want to take the benefit away prior to letting them know whether they qualify for the benefit or not. Now, Medicare Part C provides you with the option to get all of your Medicare benefits managed under one plan. Now, your Parts A and B are managed by the federal government. Now, Mr. Jones, you've paid into FICA, which stands for the Federal Insurance Contribution Act, for all the years that you worked. So now that you're turning 65, you are entitled to Part A. Mr. Jones, you have prepaid for your Part A, but you now have to start paying monthly from this point forward for your Part B. Now, since Medicare provides and manages your Parts A and B for you, it is very limited in what it covers. As we discussed, it covers some of your hospital bills and only 80% of your medical cost. The Part C plan, however, is very different. It is managed by private companies who are contracted and approved by Medicare. These companies are authorized to provide you with all of your Medicare benefits plus additional benefits, such as the 20% coverage, prescription drug coverage, dental, vision benefits, and in some cases, much more. Now, Mr. Jones, would having dental or vision coverage benefit you at all? Great. We'll see if you qualify. Now, this next slide is entitled Hidden Questions. Now, whenever we're doing a presentation, it is very important to know that the beneficiary has questions mentally that they're thinking but may never ask. So while you're delivering your presentation, it is very important that you're thinking of these questions, that you're aware of these questions, and through the course of your presentation, you are answering these questions. Many of these questions are, 1, can I trust this person who I don't know and have never seen before? Does this person sound credible or knowledgeable on the subject matter? Now, why haven't I heard about this Part C plan before? Can I afford this? Why doesn't it cost anything? What's the catch? Does this person really want to help me? Do I even like this person? Can this person really help me get the benefits I need? Now, will I have to change any habits? Will I lose my Medicare? I get extra help and Medicaid. I don't want to mess that up. What if I don't like my new doctor? Am I stuck with that doctor? Will I have to go through the red tape to see my doctors? I heard referrals are a bad thing. I heard horror stories about these types of plans. Why would it be different for me? Now, this next slide talks about something very important. It's entitled Becoming a Great Persuader. Now, mastering the art of the enrollment happens when you learn how to become a great persuader. Speaking to your beneficiary with confidence and clarity, understanding their pain, and speaking to it. This will provoke both emotion and invoke action. I mean, that is truly the definition of becoming a great persuader. You must both provoke emotion and invoke action. Now, the most successful salespeople understand this principle. You must also learn to match and mirror the temperament of the beneficiary while engaged in persuasive conversation. Now, you often hear about canned presentations and how effective a well-delivered canned presentation can be. I don't believe that. I believe canned presentations seldom work. Instead, a targeted, structured, compliant conversation will work more often than not. So wherever the beneficiary wants to begin the conversation, you let them, because once you've mastered the art of the enrollment, the conversation will usually end with the sale. Now, unfortunately, Mr. Jones, not everyone qualifies for Medicare Part C. There are 3 requirements to qualify. 1, you must have Medicare Parts A and B, which you do. 2, you must live in the service area for at least 6 months out of the year. So as long as you still live in Owings Mill, Maryland, you meet the 2nd requirement. The 3rd and only other requirement, Mr. Jones, is that you must not have end-stage renal disease, which is complete kidney failure, requiring you to be on dialysis. Great, Mr. Jones. It looks like you qualify for the Part C plan. Note, what you are about to hear next is how to compliantly obtain a telephonic scope of appointment for a field agent. Now, Mr. Jones, prior to going over the plan specifics, Medicare requires that we attain a valid scope of appointment. This means we're going to document our appointment with the Part C plan provider. Now, I'm going to do that by calling into my help desk via a conference call, where the representative will document our scheduled appointment, which will be 48 hours from today. Now, Mr. Jones, the representative will ask you for your name, address, and telephone number, and ask you how initial contact was made. All you'll need to do is answer the questions, then will be provided a confirmation number at the end of the call. Do you understand, Mr. Jones? Great. Mr. Jones?
Okay.
Yes, I'm right here.
How are you doing today, Mr. Jones?
Good, how are you?
I'm doing wonderful. I want to thank you for calling the scope of appointment. My name is Brenton. For quality and compliance purposes, this call will be recorded. May I please have your first and last name?
Robert Jones. Okay.
Thank you, Mr. Jones, and that's Robert, R-O-B-E-R-T, last name Jones, J-O-N-E-S. Is that correct?
Yes, that's correct.
Thank you. This will only take a minute of your time and will verify that our sales agent has your permission to discuss a Medicare Advantage plan with you. You are not required to provide any health-related information to the plan representative as part unless it will be used to determine enrollment eligibility. May I please have your address and telephone number?
Yes, my address is 2516 West Franklin Street. That's in Baltimore, Maryland. And the zip code is 21216. My phone number is 443-253-1171.
you, Mr. Jones. I'm going to go over this information to just verify that I do have it correct. That is 2516 West Franklin Street, and that's Baltimore, Maryland. Zip code 21216, and your phone number starting with the area code is 443-253-1171. Is that correct?
Yes, that is correct.
Thank you so much. And may I have the date and time of your appointment?
I think the gentleman wants to come by 10 o'clock on Wednesday.
On Wednesday?
Yes.
Okay. And that's 10 a.m., is that correct?
Yes. I think that's October 1st, I guess.
Correct.
That is correct. That's going to be Wednesday, October 1st, 2014 at 10 a.m. Is that correct?
Yes.
Okay. And may I please have the first and last name of your agent? Thank you, Mr. Harris. And your name is S-P-E-W-A-R-T, last name Harris, H-A-R-R-I-S. Is that correct?
That is correct.
Thank you, Mr. Harris. And may I have your agent ID number?
462.
462, is that correct?
Yes, that is correct.
Okay, may I speak back with Mr. Jones?
Yes, ma'am. I'm right here.
Thank you, Mr. Jones. And what was the initial method of contact with the agent?
Well, originally I mailed in a card to the office, and then he called me back on the postcard.
Now I will need to read a brief disclosure for you, and at the end of it, I'm going to ask you a yes or no question, okay?
Okay.
Contracted with Medicare for HMO, PPO, and PDP plans, and with select state Medicaid programs. Enrollment depends on contract renewal. The appointment with this agent is to discuss a Medicare Advantage prescription drug plan. A Medicare Advantage prescription drug plan must cover Part A, Part B, and Part D prescription drugs. In most HMOs, you can only go to doctors, specialists, and hospitals in the plan's network except in an emergency. By agreeing to this appointment with the licensed sales agent, you will discuss the Medicare Advantage plans. The person that will be discussing plan options with you is not with the federal government. They are either employed or contracted with, and they may be compensated based on your enrollment. Do you agree to have a sales agent discuss Medicare Advantage plans with you at this appointment?
Yes, that'll be fine.
Okay, I will be providing you with the confirmation number. Do you have a pen and paper available?
Yes, I do.
Okay, while we wait for your confirmation number, I'd like to thank you for calling. If you should have any questions, please feel free to contact your agent or visit us on our website at www.com.
Okay.
And then I would give you your confirmation number.
Note: you will now hear how a telephonic sales agent compliantly records a scope of appointment for lead pieces that are not a Medicare Health Plan's Business Reply Card or BRC, by clearly stating the CMS required disclaimers prior to going over any plan specifics. The name of the company that is authorized to offer you these additional benefits in your area of Baltimore County is a company by the name of. Now, Mr. Jones, they are what is known as a Medicare Advantage organization. The representatives, which I am one, Mr. Jones, we are licensed insurance agents in the state of Maryland. We are also certified and appointed. Now, of course, you are not under any obligation at all to select a Part C plan. Should you choose a plan, I may be compensated. Now, I am not an employee of Medicare, but you do at the very least give me permission to discuss the benefits of the Part C plan with you today. Great. Note: the presentation from this point forward is the same for both telephonic and field agents. Mr. Jones, there are a number of plans you may qualify for today. In order for me to ensure you receive all the benefits you're entitled to, I will need to confirm the current benefits you have on file with Medicare. Mr. Jones, I currently have your zip code as 21117. Is that correct? Now, always get the beneficiary to say yes before asking for the Medicare claim number. This is the reason why I confirm the zip code first. Now, Mr. Jones, what is your Medicare claim number? Thank you. To confirm, I have your claim number as. Is that correct? Thank you. Mr. Jones, I have confirmed your benefits on file, and congratulations. The plan you qualify for is... Now, I was able to confirm Mr. Jones' Medicare benefits simply by going to the Medicare website, medicare.gov. Mr. Jones, this plan has a $0 monthly premium, so when going to see your primary care doctor, you will not have to pay the 20% associated with your Part B. Your Part C plan will eliminate that 20%. So when going to your primary care doctor for an office visit, you will only pay $15. Now, when referred to a specialist for an office visit, your copay will only be $45. Your emergency room visits, of course, they are covered as well. And unlike the copays typically associated with your Part A, the $65 copay will be waived by your Part C plan, Mr. Jones, as long as you are admitted as an inpatient within 24 hours of arriving at the hospital. Now, Mr. Jones, if you are admitted as an inpatient, as we discussed, your Part A has an annual deductible of $1,216 and the 20% coinsurance for the medical care you receive while you're in the hospital. Now, these copays are associated with the Part A of your Medicare. Fortunately, those costs will go away with your Part C plan. Mr. Jones, you will enjoy some of the biggest savings under your Part C plan, hospitalization coverage, because if you are admitted as an inpatient, your copay will only apply to the first 6 days that you are in the hospital. God forbid you receive a catastrophic diagnosis or have a catastrophic accident and have to be rushed to the emergency room. If you require emergency surgery, regardless of cost, you will not be responsible for the 20%. Now, whether you have to remain in the hospital for 1 week or 3 months, your copays will only apply to the first 6 days that you're in the hospital. So in this scenario, Mr. Jones, you will only be assessed a $265 copay from days 1 through 6, but beginning on day 7, 100% of your hospitalization cost will be covered by your Part C plan. Now, what this plan will provide you, Mr. Jones, is a peace of mind in knowing that if you do have a medical emergency, you will have affordable access to your health care. When covering the summary of benefits, it is important to remember that even though you are not afforded any latitude on the content, you can and must still deliver the content within the framework of a conversation. Example: Mr. Jones, when going to your primary care doctor, your copay for that office visit will only be $15, as opposed to the 20% copay you are paying for now. It is very imperative that you provide the contrast between what they have and what they now qualify for. Every plan benefit should be explained in this manner. Also, when covering the presentation manual, generally known as the flip book, you should always personalize it. Example: if the beneficiary is being enrolled into an HMO and the organization's flip book describes the coordination of care, i.e., referrals to specialists, etc., always use the name of their doctor when illustrating the procedure and refer to stories and testimonials of other beneficiaries, if you have them. That will help make your beneficiary personally identify with the benefit. The same is true, Mr. Jones, if you require any outpatient procedures, whether it's as routine as a colonoscopy or more involved like a hip or knee replacement. 100% of that procedure will be covered. Your only copay associated with that procedure will be $264. Your X-ray and lab services, such as your blood test, will be covered at a $0 copay. Your Medicare-covered diagnostic procedures and tests are covered on a sliding scale. So tests and procedures such as your MRIs, CT scans, even your echocardiograms would be covered with a maximum copay of $200. You could pay as little as $0. Now, Mr. Jones, you'll be very happy to know that you also qualify for additional benefits, such as dental and vision. You previously mentioned that dental and vision coverage would benefit you. Is that correct, Mr. Jones? Good. Now, Mr. Jones, do you wear glasses at this time? I see. Well, you'll be happy to know that we can help you with that as well. So, starting on October 1st, 2014, when your Part C plan goes into effect, we will assist you in getting a new pair of glasses. So what you'll notice here is the theme throughout this presentation, which is assuming the sale. Mr. Jones has identified that he has a specific need for a new pair of glasses. So I use that as an opportunity to tie Mr. Jones' needs to the new plan benefits. So Mr. Jones, as of October 1st, you will enjoy a $100 allowance to purchase a pair of glasses. And as long as the glasses are $100 or less, you will not have any out-of-pocket expense. You can also use the $100 allowance to repair glasses you may already have. You'll also be entitled to a supplemental routine eye exam every year and screenings for diseases and conditions of the eye, such as cataracts or glaucoma. Your plan also comes with preventive dental benefits. You'll be entitled to an oral exam and a cleaning every 6 months and one bite wing x-ray once a year. Your panoramic x-rays are also covered under preventive care, but once every 3 years. Mr. Jones, the standard does not include comprehensive dental benefits, but it can be added as an option. For only $19.90 a month, you will enjoy a $1,000 allowance, which can be used for extractions, fillings, and some denture work. Now, a full list of your dental benefits will be listed in the evidence of coverage document. You will also receive a provider directory and a drug formulary listing all prescriptions covered by your plan. One of the greatest features of the prescription drug coverage, Mr. Jones, is that there's no annual deductible, which means you'll start enjoying low copays right away. There are 5 tiers prescriptions in the formulary are covered under. Tiers 1 and 2 are the preferred and non-preferred generic tiers, so a 30-day supply of your prescriptions are $3 and $10 respectively. Tiers 3 and 4 are preferred and non-preferred brands, so a 30-day supply of prescriptions are $45 and $80. Tier 5 is the specialty tier. There is a 33% coinsurance for this tier. Note, you always want to refer back to the evidence of coverage when explaining the dental benefits. As I mentioned before, Mr. Jones is a Medicare Advantage organization that's been around since they currently help over get affordable access to their health care around the world. They do this by partnering with a very strong team of doctors. Mr. Jones, do you have a primary care doctor? Good. What is the name of your primary care doctor? Okay. And how often do you see your primary care doctor, Mr. Jones? Is it twice a year, 4 times a year, or as needed? Okay. Now, do you currently see any specialists on a regular basis, Mr. Jones? All righty. Now, Mr. Jones, is your primary care doctor also located in Baltimore County? Good. Do you currently see your doctor at the 300 Red Brook Boulevard, Suite 12 address? Excellent. Now, as of October 1st, when seeing Dr. Green, you'll present. In fact, You'll use this card when accessing all of your Medicare benefits, including going to the hospital and filling your prescriptions. Mr. Jones is very committed to you. As I mentioned, they partner with a team of doctors and provide them with extra tools to give you the time, attention, and quality of care you deserve. Is dedicated to keeping all of our members healthy. So as a result, you will be covered for your annual physicals and screenings, such as your colorectal screenings, which will help reduce your risk of colorectal cancer. Now, they do contract with the Centers for Medicare and Medicaid Services and is authorized to offer Medicare Advantage plans in your area. Another added benefit to you from your Part C plan is that you will have 24-hour-a-day, 7-day-a-week access to a medical professional. So if your doctor's office should be closed late at night or over the weekend, and you have a medical question that cannot wait until the following morning, you will be able to call a registered nurse and get your medical questions answered. Your team of doctors work together to provide better health care with a focus on prevention. Now, Mr. Jones, Dr. Green will be the team leader for all of your healthcare needs, so he knows your entire health picture. He will continue to refer you to the right specialists and hospitals and work with them to keep you healthy. This teamwork approach makes sure you receive quality care when and where you need it. Another great feature of your Part C plan is that it provides you with the same rights and protections as Medicare Parts A and B. Now, Mr. Jones, we are able to assist you with these benefits today because you have earned this additional coverage. Now, during your presentation, there is one thing you must do. That is assume the sale. No matter how persuasive and likable you are, you have to begin every presentation with the mindset of doing the enrollment. This means while you are covering the 4 parts of Medicare, and while you're going over the summary of benefits, you will need to do test closes. Example, Mr. Jones, once your benefits go into effect on the first day of the following month, we will help you get the pair of glasses you need. Every benefit they don't receive that's offered by your plan is an opportunity for a test close. When you are engaged in the right conversation with the beneficiary and you are asking the right questions throughout the presentation, you will not have to ask for the sale at the end. You will simply explain the enrollment process and allow the beneficiary to follow the procedure. If you have done your job effectively, you'll never have to ask for an enrollment. Mr. Jones, whenever a beneficiary decides to select the Part C plan, they must have what is known as a valid enrollment period. There are 3 different enrollment periods. The first enrollment period is called the Initial Coverage Enrollment Period, also known as Aging into Medicare. It begins 3 months prior to your 65th birthday. It includes the month you turn 65 and extends 3 months past your birthday. The second enrollment period is called the Annual Enrollment Period, or the Open Enrollment Period. This begins on October 15th of every year and ends on December 7th. The third enrollment period provides beneficiaries who have certain extenuating circumstances a special enrollment period. This allows the beneficiary to enroll outside of the open enrollment period. A few examples of what would qualify you for a special enrollment period include having a low-income subsidy that assists you with your prescription drug cost, having a chronic illness which may qualify you for a special needs plan, or having both Medicare and Medicaid, just to name a few. The enrollment period we'll be using for you today, Mr. Jones, is the Initial Coverage Enrollment Period, because you are new to Medicare, also known as aging into Medicare. Now, Mr. Jones, do you have something to write with? I asked that question because the Centers for Medicare and Medicaid Services require that all enrollments must be done on an inbound call. I'm going to give you the number to my enrollment line. That number is Great. As you know, Mr. Jones, all of our calls are recorded, so we are going to end this call and begin a new recording for the purpose of the enrollment. I'm going to ask that you give me a call back on my enrollment line. Then we'll proceed with implementing your benefits, which will have an effective date of October 1st. I will not take another call, so when you do call me right back, I'll be available. Do you understand, Mr. Jones? Great. We'll talk in a few seconds. Talk to you soon. Now, what you just witnessed there is how we segue into the close without asking for the sale. Because per CMS guidelines, we are not allowed to ask the beneficiary if, based on the information we've gone over, would they like to enroll. So what we do instead is we simply assume the sale by illustrating what the process of the sale will be, and then we allow the beneficiary to follow our instructions. Good afternoon. Thank you for calling into the Senior Processing Center. This is Bob speaking. Yes, Mr. Jones. Thank you for calling back into the Senior Processing Center. As you know, Mr. Jones, our calls, they are recorded for quality control purposes. And to confirm, you are calling back to enroll into the... Is that correct? Great. I can help you with that. Before we get started, Mr. Jones, I'd like you to know that you are not required to provide any health-related information unless it'll be used to determine your enrollment eligibility. We are here to help you make the best choice that meets your needs. And just to verify, I am speaking to Mr. Gregory M. Jones, the person who wants to enroll today. Is that correct? Great. Now, Mr. Jones, I'm going to send you the plan information in English. Is that okay? All right. And the name of the plan that you selected today, Mr. Jones, is the... Is that correct? Okay. Now, Mr. Jones, your effective date for this plan will be October 1st, 2014. And the enrollment period we'll be using today is the fact that you are new to Medicare. Is that also correct, Mr. Jones? Excellent. At this time, I'm going to enter your name on the application as it appears on your Medicare card. I have your last name as Jones, and that's spelled Jones. Your first name is Gregory. That is spelled Gregory. And of course, your middle initial is M. Is that correct, Mr. Jones? Okay. Now I have your date of birth as... I have your gender as male. And your telephone number as... Now I have your physical address as... Mr. Jones, is this the same as your mailing address? Okay. Now, who would you like to include as an emergency contact person on the application, just in the event we're unable to reach you for any reason? Of course, this is optional, and you do not have to include an emergency contact person. All right. Now, I have your Medicare claim number as A. Is that correct? I also see that your Part A and B have the same effective dates of October 1st, 2014. Is that correct, Mr. Jones? Okay. Well, thank you. Now, Mr. Jones, the next section of the application does not apply to you, but it could at some point. So I'm going to explain this section to you. Okay? All right. Now, in 2006, the Part D of Medicare began. In that same year, the late enrollment penalty was instituted. The penalty applies to Medicare beneficiaries who go for a period of 63 days or longer without credible prescription drug coverage. If this ever happens, Mr. Jones, you'll be notified by CMS. Now, you are aging into Medicare. So on your effective date of October 1st, 2014, you will have the benefits of all four parts to Medicare, which includes Parts A, B, C, and D. So, Mr. Jones, This enrollment satisfies the requirement of the late enrollment penalty. Now, people with limited incomes, they may qualify for extra help to pay for their prescription drug cost. If eligible, Medicare could pay for 75% of drug costs, including monthly prescription drug premiums, annual deductibles, and coinsurance. Additionally, those who qualify will not be subject to the coverage gap or the late enrollment penalty. Mr. Jones, have you ever heard of the coverage gap or the donut hole? No? Okay. I'll explain that for you now. All Part D prescription drug plans, they work the same. They all work off of a calendar year from January 1st through December 31st. Once the total cost of your prescriptions, including what the plan pays, reaches $2,850, this is when you would enter what is known as the donut hole, or the coverage gap, where your non-covered generic drugs would be discounted by 28% and your brand drugs would be discounted by only 52.5%. Now, Mr. Jones, all this means is that the cost of your prescriptions would go up. Now, you will exit the coverage gap when the cost of your prescriptions for the year exceeds $4,550. This is when the Social Security Administration would step in and bring the cost of your drugs down to the $2.55 for your generics and $6.35 for brand, or 5%, whichever is greater, until the calendar year ends. Now, Mr. Jones, I know you've answered this question before, but for the purpose of this recording, I must ask the question again. Sir, do you have end-stage renal disease? Okay. Mr. Jones, do you receive any military benefits, VA or TRICARE? All right. And Mr. Jones, we are going to confirm the accuracy of the information we have on your application thus far, okay? All right. Now, just to verify, I am speaking to Mr. Gregory M. Jones, the person who wants to enroll. Is that correct?
Now, at this point within the enrollment, you have asked the beneficiary 3 different times to confirm their intent to enroll. This is very important. Once you have confirmed the accuracy of the application, you will then proceed to read the agreement and release statement. Now, at this point, you must read the agreement section directly from the enrollment form. This concludes presentation number 1. In presentation number 2, the beneficiary will have an existing Medicare Advantage plan and Slim B. Let's begin.
Mr. Jones, do you currently have Medicare Parts A and B? Good. What do you have that helps you cover the 20% and other copays Medicare does not cover? I see. So when you go to the doctor, hospital, or pharmacy, what card do you use, Mr. Jones? Is it your Medicare card or a different card? Now, you'll notice that I am very specific when asking the beneficiary which card they use. Oftentimes, when asked the question if the beneficiary has anything secondary that helps them cover the 20% that Medicare does not cover, beneficiaries will oftentimes say, no, they don't have anything. So to further drill down and to clarify, I ask the question specifically. When you go to the doctor, pharmacy, or hospital, what card do you use? And then I give them a choice. Is it your Medicare card or a different card?
Now, asking that specific question helps the beneficiary recall what plan they actually have.
Okay. So, Mr. Jones, it sounds like you have the... Is that correct? Okay, thank you. Now, is that a plan your former employer provided, or did you get that plan on your own? I see. Now, are there any monthly premiums associated Do you currently take any prescriptions at this time, Mr. Jones? Now, how much would you say your copays are, Mr. Jones? Do you pay approximately $2.55 or $6.35 for your prescriptions? I see. Do you have a primary care physician, Mr. Jones? Well, how often do you see your primary care doctor? Is it twice a year, 4 times a year, or as needed? Okay. Now, how long have you been seeing your doctor, Mr. Jones? Is your doctor also located in Baltimore County? Is there a copay for your office visit, Mr. Jones? Okay. So you pay $10 for your office visit. Do you take public transportation to your medical appointments, or do you get there on your own, Mr. Jones? Okay. Now, do you see any specialists on a regular basis? I see. What is your copay when going to see your specialist, Mr. Jones? Mr. Jones, does your plan offer any additional benefits, such as dental or vision benefits? Okay, I understand. So if you needed a pair of glasses, Mr. Jones, do you receive an allowance that would help you with the cost of the glasses? Okay. What about dental? Mr. Jones, I'm going to do everything I can to help you save money and get more out of your Medicare benefits. Would that help you at all, Mr. Jones? Excellent. Mr. Jones, what is the name of your primary care physician? Okay. And the name of your specialist? And what kind of specialist is Dr. Black? I see. Now, what county is Dr. Black located in? Do you see any other specialists on a regular basis? Okay. So you're currently seeing Dr. Black every 3 months, is that correct? Now, has the doctor mentioned reducing the amount of visits at all to perhaps twice a year? And are you taking public transportation to Dr. Black's office? All right. Well, Mr. Jones, if you look at your Medicare card, you will notice 2 parts listed on that card, Parts A and B. Now, as I'm sure you know, your Part A covers your hospital, while your Part B covers 80% of your medical bills. Now, even though there are 2 parts listed on your card, there are actually 4 parts to your Medicare. The third part is Part D, which provides you with your prescription drug coverage. And then the final part of Medicare is Part C. Now, the help I'm planning on providing you with today, Mr. Jones, will come from the Part C of Medicare. So I'm going to focus on this part for just a moment. Now, Medicare Part C provides you with the options to get all of your Medicare benefits managed under one plan. Your hospital, medical, and prescription drug coverage would all be managed by a private company who is contracted and approved by Medicare. So as long as you qualify, Mr. Jones, you could also be eligible for additional benefits, such as comprehensive vision and dental benefits. Now, I'm going to also see if you possibly qualify for transportation benefits as well. Would you like me to look into that for you, Mr. Jones? Okay, let's see if you qualify. Now, there are 3 requirements to qualify for Medicare Part C. The first requirement, Mr. Jones, is you must have Medicare Parts A and B, which you do. You must live in the service area for at least 6 months out of the year. So as long as you still live in Owings Mill, Maryland, you meet that second requirement. The only other requirement, Mr. Jones, is that you must not have end-stage renal disease, which is complete kidney failure, requiring you to be on dialysis. Great. Mr. Jones, it looks like you qualify for the Part C plan. Now, the name of the company that is authorized to offer these benefits in your area of Baltimore County is a company by the name of. Now, is a Medicare Advantage organization. The representatives, which I am one, Mr. Jones, we are licensed insurance agents in the state of Maryland. We are also certified and appointed by. Now, of course, you are not under any obligation to select a Part C plan. Should you choose a plan, I may be compensated. I am not an employee of Medicare, but you do at the very least give me permission to discuss the benefits of the Part C plan with you today. Now, Mr. Jones, I have access to the Medicare database. What I want to do is confirm the benefits you currently have on file with Medicare. This will ensure we don't leave any benefits on the table. Okay? All right. Now, Mr. Jones, I have your zip code as 21117. Is that correct, sir? All right. Now, Mr. Jones, what is your Medicare claim number? Well, it can be, Mr. Jones. It depends on whether you're drawing your own benefit or perhaps the benefits of a spouse. Does your claim number end in the letter A? Then it is your Social Security number. I understand, Mr. Jones. I tell you what I'm going to do. I'm going to give you my agent identification number. This identifies me with, so you'll never have to question who you spoke with today. All of our calls, as you know, are recorded, so everything we do here is documented and safe. Thank you, Mr. Jones. Now I'm going to call into my help desk. They're going to confirm all the benefits you currently have on file with Medicare. Now, Mr. Jones, I'm going to conference the representative in on the phone with us, and that person is going to ask you for consent to provide us with your Medicare benefits. When they ask you for permission, I'm going to ask that you reply by saying yes. Now, at that time, Mr. Jones, the representative will share all of your benefits with us. Once we have confirmed your benefits, I will continue assisting you. Do you understand, Mr. Jones? Great. Now I'm going to put you on a brief hold and then return with the representative. Thank you for holding, Mr. Jones. Congratulations, Mr. Jones. The plan you qualify for is called, and with that plan, you will enjoy a $0 monthly premium. You qualify for this plan, Mr. Jones, because you have partial Medicaid, also known as Slim B, and Medicare. Now, when going to see your doctor, Dr. White, instead of paying the $10 copay you are currently paying now, as of October 1st, your copay will be $0. When referred to a specialist for an office visit, instead of paying $35, we are going to save you even more money by reducing your copay down to $0. Now, your emergency room visits, they are covered as well. So as long as you are admitted as an inpatient within 24 hours of arriving at the hospital, the $65 copay will be waived. Now, if you are admitted as an inpatient, Mr. Jones, your copays will only apply to the first 7 days that you are in the hospital. Whether you have to remain in the hospital, Mr. Jones, for 1 week or 3 months, your copays will only apply for the first 7 days you were in the hospital. So in this scenario, Mr. Jones, you will only be assessed a $250 copay per day from days 1 through 7. But beginning on day 8, 100% of your hospitalization cost will be covered by the. Now, the same is true, Mr. Jones, if you require any outpatient procedures, whether it's as routine as a colonoscopy or more involved like a hip or knee replacement. 100% of that procedure will be covered. Your only copay associated with that procedure will be $300. Now, Mr. Jones, your x-rays and lab services, such as your blood test, those will be covered at a $0 copay. Your Medicare-covered diagnostic tests and procedures are covered on a sliding scale. you can pay as little as $0 or as much as $200 for a procedure that could cost you thousands, providing you even more savings. Now, typically, Mr. Jones, those tests will include your MRIs, your CT scans, or your echocardiograms. Now, Mr. Jones, you will be very happy to know that you also qualify for additional benefits, such as dental and vision. Now, you previously mentioned that dental and vision coverage would benefit you. Is that correct? Good. Do you wear glasses at this time, Mr. Jones? I see. Well, we can help you with that. Starting on October 1st, 2014, when your Part C plan goes into effect, we will assist you in getting a new pair of glasses. So, Mr. Jones, as of October 1st, you will enjoy a $200 allowance to purchase a pair of glasses. Now, as long as the glasses are $200 or less, you will not have any out-of-pocket expense. You can also use the $200 allowance to repair glasses you may already have. You'll also be entitled to a supplemental routine eye exam every year and screening for diseases and conditions of the eye, such as cataracts or glaucoma. Now, if I recall correctly, Mr. Jones, we talked about you taking public transportation to your medical appointments. Is that correct, sir? Well, the plan, Mr. Jones, includes transportation at no additional cost. So as of October 1st, you'll be entitled to 41 one-way trips and 20 round trips. That will allow you to see Dr. White once a month at no cost and your cardiologist 4 times a year. Will having transportation provided at no additional cost benefit you, Mr. Jones? Excellent. This is what I meant when I said my job is to provide you with affordable access to your health care. Now, the will not only provide you with affordable care, but it is also going to coordinate your care. This means all the care you receive will need to come from a participating provider. As a participating doctor, with Dr. White will be the team leader for all of your healthcare needs. He will refer you to all the right hospitals and specialists while working with them to keep you healthy. Now, you've been seeing Dr. White for 15 years, correct? So by now, I'm sure you trust Dr. White. Now, did Dr. White refer you to Dr. Black, your cardiologist? I see. Well, Mr. Jones, Dr. Black is not currently participating with. Would you trust Dr. White to refer you to another highly recommended cardiologist to continue your checkups? I understand, Mr. Jones. So when you really think about it, Dr. White should be credited for saving your life because he was the one who referred you to Dr. Black. So you can rest assured that he will be able to refer you to another cardiologist he trusts. Does that make sense, Mr. Jones? Well, listen, if you don't like the cardiologist for whatever reason, we can always refer you to a different one. My focus is getting you all the benefits you are entitled to and help improve your quality of life. Okay? All right, excellent. Whenever a beneficiary decides to select the Part C plan, they must have what is known as a valid enrollment period. There are 3 different enrollment periods, Mr. Jones. The first enrollment period is called the Initial Coverage Enrollment Period, also known as Aging into Medicare. It begins 3 months prior to your 65th birthday. It includes the month you turn 65 and extends 3 months past your birthday. The second enrollment period is called the Annual Enrollment Period, or Open Enrollment. This begins on October 15th of every year and ends on December 7th. The third enrollment period provides beneficiaries who have certain extenuating circumstances a special enrollment period. Now, this allows the beneficiary to enroll outside of the open enrollment period. A few examples of what would qualify you for a special enrollment period include having a low-income subsidy that assists you with your prescription drug cost, having a chronic illness which may qualify you for a special needs plan, or having both Medicare and Medicaid, just to name a few. Now, the enrollment period we'll be using for you today, Mr. Jones, is a special enrollment period. And this is because you have partial Medicaid, also known as Slim B, and Medicare. Now, Mr. Jones, the plan that we enrolled you on is called the... Now, that plan is specifically designed to help those who either have full Medicare and Medicaid, or, as in your case, Mr. Jones, partial Medicare and Medicaid. So whereas some of the copays you enjoy will be zero, there will also be copays and cost shares for certain medical benefits as well. Do you understand that, Mr. Jones? Excellent. Now, Mr. Jones, do you have something to write with? I asked that question because the Centers for Medicare and Medicaid Services require that all enrollments must be done on an inbound call. I'm going to give you the number to my enrollment line. Mr. Jones, that number is... Okay. Now, as you know, Mr. Jones, all of our calls are recorded. So we are going to end this call and begin a new recording for the purpose of the enrollment. Now, I'm going to ask that you now give me a call on my enrollment line. Then we'll proceed with implementing your benefits, which will have an effective date of October 1st, 2014. Now, Mr. Jones, I will not take another call. So when you do call me right back, I'll be available. Do you understand, Mr. Jones? Great. We'll talk in a few seconds. Oh, and Mr. Jones, one more instruction. When you dial my toll-free telephone number, you do not have to wait to be prompted to dial my extension. You'll simply dial my extension and then be connected directly to me. Do you understand that, Mr. Jones? Outstanding. I'll talk to you in a few moments. Thank you. Good afternoon. Thank you for calling the Senior Processing Center. This is Bob speaking. Yes, Mr. Jones. Thank you for calling back into the Senior Processing Center. As you know, Mr. Jones, our calls, they are recorded for quality control purposes. And to confirm, Mr. Jones, you are calling back in to enroll into the... Is that correct, Mr. Jones? Great. I can certainly help you with that. Before we get started, I'd like you to know that you are not required to provide any health-related information unless it'll be used to determine your enrollment eligibility. We are here to help you make the best choice that meets your needs. And just to verify, I am speaking to Mr. Gregory M. Jones, the person who wants to enroll today. Is that correct? Now, Mr. Jones, I'm going to send you the plan information in English. Is that okay? All right, and the name of the plan you selected today, Mr. Jones, is the... Is that correct? Now, your effective date for this plan will be October 1st, 2014. And the enrollment period we'll be using for you today, Mr. Jones, is you have both Medicare and Medicaid, or your state helps pay for your Medicare premiums. Is that correct, Mr. Jones? Excellent. Now, at this time, I'm going to enter your name on the application as it appears on your Medicare card. I have your last name as Jones, and that's spelled Jones. Your first name is Gregory, and that is spelled Gregory. And your middle initial, I have that as M. Is that correct? Okay. Now, I have your date of birth as, and your gender as male, and your telephone number as. I have your physical address as. Now, Mr. Jones, is this the same as your mailing address? Okay. Now, who would you like to include as an emergency contact person on the application, just in the event we are unable to reach you for any reason? Now, of course, This is optional. You do not have to include an emergency contact person. All right. Now, I have your Medicare claim number as A. Is that correct? I also see that your Part A and B have the same effective date, which is June 1st, 2003. Is that correct, Mr. Jones? All right, outstanding. Now, Mr. Jones, the next section of the application does not apply to you, but it could at some point. So I'm going to explain this section to you, okay? All right. Now, Mr. Jones, you have a low-income subsidy on file, and as a result, the Social Security Administration will pay the monthly premium that is associated with the Total Care Plan. So even though the plan has no cost to you, the Social Security Administration does pay the $25 monthly premium associated with the prescription drug coverage your plan provides. Do you understand, Mr. Jones? Good. Now, in 2006, when the Part D of Medicare began, there was a late enrollment penalty that was also instituted. The penalty applies to Medicare beneficiaries who go for a period of 63 days or longer without credible prescription drug coverage. If this ever happens, Mr. Jones, you will be notified by CMS. The next section of the application, Mr. Jones, describes your low-income subsidy in more detail. Now, people with limited incomes may qualify for extra help to pay for their prescription drug cost. If eligible, Medicare could pay for 75% of drug costs, including monthly prescription drug premiums, annual deductibles, and coinsurance. Additionally, those who qualify will not be subject to the coverage gap or a late enrollment penalty. Now, this is why the previous section did not apply to you. Do you understand, Mr. Jones? Good. Now, have you ever heard of the coverage gap or the donut hole? All right, Mr. Jones, I'll explain that to you. Now, Mr. Jones, please be advised that this next section does not apply to you because of your low-income subsidy. Now, all Part D prescription drug plans, they work the same. They all work off of a calendar year from January 1st through December 31st. Once the total cost of your prescriptions, including what the plan pays, taken during the course of the year, reaches $2,850, this is when you would enter what is known as the donut hole or the coverage gap, where your non-covered generic drugs would be discounted by 28% and your brand drugs would be discounted by only 52.5%. Now, all this means is that the cost of your prescriptions would go up. You would exit the coverage gap when the cost of your prescriptions for the year exceeded $4,550. This is when the Social Security Administration would step in and bring the cost of your drugs down to the $2.55 for your generic or $6.35 for your brand, which is approximately the amount you are paying for your prescriptions now. Do you understand that, Mr. Jones? Okay, great.
Now, this concludes the Blueprint Training Solutions webinar. We want to take this time to thank all of those in attendance. We also want to, at this moment, direct you to our website, which is www.blueprinttrainingsolutions.com. And on the website, you will find great resources and a way to stay connected to the authors of Blueprint Training Solutions. You'll find the Medicare Advantage Guide, which features the Benefits Coordinator, which introduces the new customer engagement model. Other pertinent information can be found at www.blueprinttrainingsolutions.com.